So we studied like 6 or 7 lesions now, that is the cortical lesions, cortical extensive lesions, internal capsule lesions, and also the cervical medulla and the cervical cord lesions, and this arm only lesion, and also we studied the like brachial plexus lesion also. Okay. So next there is an isolated involvement of your leg area, that is then contralateral crural monoparesis, also precluded by lower motor lesion also, that is by the lumbar plexopathy. If the lumbar plexopathy is affected, or the like cortical leg area is only affected, then it also contralateral crural monoparesis. If the upper limb is only affected on the one side, then it is contralateral brachial monoparesis. This is contralateral crural monoparesis. So this is a figure showing the lesion that is at the lumbar plexopathy. Okay, in multiple noted. So here the leg area is only affected here. Okay, in this region. Next, the seventh lesion. Here the seventh lesion means the leg area is affected, but both the hemispheres leg area is affected. Means both the legs are affected here, and these type of lesions are also seen in case of, we know that here the pons, the facial nerves are going here, the medulla, the pyramidal decussification happens, that is cervical cord, and after going down thoracic cord, here the thoracic and the lumbar cord, both sides of the thoracic cord and the lumbar cord is affected here. Okay, so bilateral involvement of both leg areas. Okay, that is we call it as paraparesis, because both lower limbs are affected here. Bilateral involvement of both leg areas, we call it as what? Paraparesis. So this is called the paraparesis. Okay. Next is bilateral element lesion or lesion also produces parapa. Bilateral this element lesion also produces this paraparesis. Not only this this lesion, this also will leads to this element lesion, that is paraparesis. This is bilateral cortical area involving the leg and arm area also. So this will leads to quadriparesis. Here this and this arm area will be also in both bilaterally. Then that will be quadriparesis, means both bilaterally upper limb and lower limbs will be affected. So and the cervical affecting bilateral so cervical cord affecting the bilateral pyramidal cord. So here it was the it was what is affecting here, it was the thoracolumbar. This pyramid was the thoracolumbar cord was affected. Here what is affecting? Here the cervical cord was affected here. Cervical cord is affecting here, that is bilateral pyramidal cord. Okay, so look at this figure. So we can look at here, these two sides are affected here, and while coming here the cervical cord, bilaterally the cervical cord is affecting here. Okay, then after coming down here also these regions are also affected. So this leads to like total bilateral quadriparesis. We call it as quadriparesis. So these are the different types of lesions, that is by the motor pathway side. Okay, that's it.